Hi, I am Dr. Nanda Rajaneesh. I am surgeon from Apollo Spectra and Sakrawal Hospital. I like to talk to you about gallstone disease. So, why do the stones form in the gallbladder? First of all, you should know that there are different types of gallstones. It could be a cholesterol large stone, round single stone, and it could be multiple stone with the facets. So, we call bile stones. So, reason for both the stones is slightly different, but in general, what are the reasons for gallstone formation? Mostly stasis of the bile juice is one of the commonest reasons. That's why women get it, because women do not eat food on time. Today is this time, next day is another time, and it keeps varying. This variation lead to stasis of the bile juice, which is very thick, and not drinking enough water, not hydrating yourself, the bile is very concentrated. Oxidant diet also, bile is very concentrated, and this diet makes thick bile juice, and thick and slimy bile juice can deposit the contents in the gallbladder. And other reason is like hypercholesteremia. Increased cholesterol levels in the blood can lead to cholesterol stone, and other reason could be overeating food, certain foods, oxidant diets is one of the reason I told you already. So, like this, more often women are the one who get the gallstones. It's kind of hereditary, that is familial. In the same family, many people can get gallstones because their eating habits, type of food they eat falls similar, and eating so much of sweets also can lead to gallstones. So, what does it do? Once the gallstones are formed, they try to slip and they try to block in the gallbladder duct, bile duct, cystic duct we call it. In the cystic duct they get blocked, and the gallbladder can enlarge and can form empyema, or can form the enterocoel, kind of the mucous secretions, enlarging the gallbladder, mucocoel I would call it, mucocoel and not enterocoel, mucocoel. Now, and it gets blocked. The other thing that can happen, it can slip into the common bile duct, can cause jaundice, and it can slip near the pancreas, so it can cause pancreatitis. These are some of the complications, and recurrent abdominal pain, back pain, shoulder pain, right side, you should be aware. This is, and if the gallstone stays for more than 15 years, 100% it may lead to gallbladder cancer. This is the reason gallbladder has to be removed once there are gallstones in the gallbladder. Now, how to prevent? Only mostly diet. They say taking too much of multivitamins can lead to gallstones. They say that to concentrate your bile juice, and eating antioxidant diet, foods on time, and not skipping diets, exercising, and keeping the bile juice very thin by drinking a lot of water. These are helpful. Even coffee is helpful in preventing gallstones or making the bile juice thin. So, people with fatty liver can also get gallstones. So, once there is a gallbladder stone, laparoscopic cholecystectomy is advised. So, you can do with the experienced doctor, lap chole, and it is just one day procedure, mostly when it is done as an elective surgery. Thank you.